Yes, please, go ahead.
Okay, good evening, everyone. My name is Martha. It's nice seeing everyone in person for our first meeting. So it has been an eventful year, I must say. It's been my first time piloting a program like this where we are enforcing a co-response model where mental health professionals working with law enforcement and co-responding to EPP calls. So I started in April, mid-April, and as you can see, and as I mentioned in the last meeting back in August, the cases were low because I was just coming in. But then you slowly start to see an increase between May and July, mostly with adolescents. School is ending or it's toward the end of the school year, so there's been a lot of concerns in that area, but then between August and November, it kind of steadies, including December. Now, out of those monthly cases, the co-response, which is where I respond with law enforcement officer, it fluctuates. So in April, I only had one. The most I've had was 5, which was back in May, and also September, which is 4. November, there wasn't really any action, but I did have cases. They were more so walk-ins. So in total, I had 153 unique cases that included co-responses, that included individuals walking into town hall, that included referrals from schools, outside referrals, whether it's from, group homes or outside sources such as, people in other towns that just needed resources. So out of the 153 cases, I responded 22 times with the officers. So the co-responses I do respond to immediately. That's something I prioritize, is top of my list. When I receive a call from dispatch, I respond immediately. Now, a lot of the walk-ins and people who call in, it usually takes me some time to respond back because of scheduling. So I'll get more into that in the next.
Co-response, you don't go with the officer in the car, you meet the officer there?
Sometimes, so if they are in the area, they do sometimes, have me along on the way, but of course, they assess the situation first in terms of safety before allowing me to come with them. A lot of the time, some of them would not want me to take my own personal vehicle for safety reasons, so they do prefer to pick me up if I'm at town hall or if we're at HQ. They would rather just me right along with them for safety precaution. But for the most part, I usually take my own vehicle to the address.
And you're at like the hours again? I can't remember now which, like when you're.
So my hours have been all over the place. Originally it was Wednesday, Thursday, Friday, and Sunday. But then because of the need, we've been monitoring the times that the calls have been coming in. So we kind of adjusted that. It's moved the Sunday to Monday. So now I'm here Mondays, 11 a.m. to 8 p.m. Wednesday, Thursday, Friday, 7 a.m. to 4 p.m. So with the referrals, as I mentioned before, so when a 911 call is made, dispatcher or the watch commander notifies myself of the incident. They give me a brief description of what's going on. And of course, they dispatch the officers on scene to clear it for safety, and then that's where I come in. So either during or after hours or when I'm not available, a referral is either left in my mailbox, they email me with the incident number so that I can look it up, or they just give me a call and leave me a message. Or they text me since they have my work phone number. Referrals come from various sources. As I mentioned, the primary sources, Maple Police Department or fire, EMS. But I've also been getting referrals from the detectives, town hall staff, such as health department, engineering, building, and even Ms. DePalma, the township prosecutor. I've been receiving referrals from the schools, the elementary schools, Tuscan, Seth Boyden, Bolden.
On students?
Mm-hmm.
Why are they
Certain things when it comes to like case management. such as like, following up with the individual who they have a concern with in terms of like home conditions or if there's like a language barrier and they need resources for something, they usually reach out to me just to see if I can help out. In that sense,
How do you interact with the school personnel? Like, isn't there like a social worker in the school?
there are social workers in the school. If they need to do a wellness check and it's after school hours, let's say it's after 3:30, that's where I come in.
Okay,
There was an example that took place last week where there was no social workers in the school at that time because everyone was gone and they needed to conduct like a risk assessment on a student.
Mm.
Otherwise, they would have had to take in that student to the hospital where they would have stayed, in the hospital for like 6-7 hours.
yeah,
So I was able to go there, meet with the students, speak to them, their Haitian families, so I spoke to the legal guardian and Haitian Creole. Just to kind of explain to them what's going on. And so that I can get more information, feedback on the student, just to be able to provide more of an assistant. Thankfully, it did not escalate, the child did not need to go to the hospital, and, they were cleared to go back to their residence. But in a situation like that, if it's after school hours. But,
Do you feel like you've got a clear, like, SOP between sort of like where your responsibilities end and when school
Yes.
responsibilities should start?
that is something that I made very clear, to the
That could
schools.
explode.
Yeah, I made it very clear to the school social workers, and even, the vice principal, like the
Yeah.
assistant principals over there. I'm here for after school hours,
Mm.
not during school hours, which is what, like around 7 a.m. to about like 3:30. The school social workers, they're there for a reason, so they have to take care of the kids, but anything after that, like if they need a wellness check or if they have any additional concerns, that's when they can reach out to PD. And then they can, call me to come in to do a wellness check if needed.
So what's
Have you,
the-
like, sorry.
no, sorry. So what's the close up process then? When you've done something after school, do they reach out to you or do you reach out to this for the next day or the next week or for that particular?
So I usually ask if they have an IEP, they're like with a social worker or a guidance counselor or whomever.
Mhm.
So I just reach out to that guidance counselor, the social worker, let them know what took place so that they can follow up with the student as needed. Whether they meet with them on a weekly basis or more, I just let them know and then I'm finished
Okay.
with that.
Okay, okay.
Did you
And
have-
that would count like when you count cases, it's like, it could be something that you just had one interaction with the person.
Right.
Yeah.
Right. Mhm.
And you said it's 153 unique
Yeah,
cases,
so
so,
it's different cases.
so there's
rather than-
repeated visits with those, so. it could
Right, it's
be-
not the same person,
Yeah.
it's different cases.
Yeah.
Yeah.
So,
So I'm also very curious about the school interaction, so those times when they're calling you, are those times when previously maybe they would have just called the police?
Yeah.
And now they're calling you because you're here as resource as well, or are those cases where they just wouldn't have called, you mentioned the hospital, they wouldn't have.
So
They didn't call
typically
anyone else in the town structure.
so with this one particular student, they did call me because they didn't have a social worker on site and it seemed, I don't know what exactly their protocol is. But because I was available, I went there, but I did inform them that if something like this were to happen, it just might be best to take the child to the hospital. If it's severe enough. Granted, this was after school hours and I was here, this was about like 10 minutes before I was scheduled to leave. So I did show up, but they are supposed to have a protocol in place, but that protocol is, I'm not 100% sure. But I don't get calls like this often from the school.
Yeah.
Usually if it's from the school, either the detectives bureau, like Jamodi or whomever was already involved with the case. And then he just, he refers it to me as like a follow-up to provide resources for the family, the parents, the child. This particular case from the middle school, there was no law enforcement, interaction in the past. This was like the very first time and they just needed, I guess, some sort of guidance as to what to do in a situation like that. So it's not like it's something that I get often. It's, like a once in a while thing. Yeah.
Thank you.
Folks, can I jump in at point of order here?
Mhm.
A couple of things. As we ask questions about examples of something, we should just be mindful and thoughtful about not doing so in a manner that could unintentionally identify the person that we're talking about. I think we got very close to that line, that borderline, talking about this particular student interaction. So let's just be careful. There was unique characteristics of that student that were identified. This is being recorded right now, so we don't want to create unintentionally any additional harm. Also, I suggest, it's just a suggestion, that we let Martha get through the presentation, jotting down our notes for questions afterward. Just a suggestion.
I think it's a good suggestion.
Yeah, that's a
I
good
second
suggestion.
that suggestion.
Sorry.
Okay,
We are very interested.
yeah,
in
all of
all
us. So yeah, the schools, if they have any health concerns or any assessments, walk-in services, like if an individual comes in. Requesting like, either utility assistance or rental assistance, food pantry, county services. I, along with the local health outreach coordinator, Talia, we provide resources to these individuals as well. So some of the services that have been provided, so like I said, most of the EDP calls come from the police department. Wellness checks and home conditions, from building or the engineering department, especially if this individual may be a hoarder. And they're just concerned about, the well-being of that individual, I get referred to those as well. I've been, providing language and resources to individuals who've experienced robbery or other traumatic, events. Individuals in domestic violence situation for both the victim and the aggressor. Resources to individuals who are also at risk for homelessness or who is homeless. So I've also been assisting the health department with some of their tasks as well when I do have downtime, such as helping them with the community fridge maintenance, the health fair, or even assisting with the COVID research clinic. I've been identifying and reaching out to local food pantries, individuals and mental health providers and organizations, and building relationships with them, such as Glory Healthcare, which is a 2 nurse practitioners that provide medication management and counseling to individuals. Beata Home Nursing Care, who provide in-home care services for the elderly. We Built a Hill, which is a nonprofit organization geared towards adolescents and young adults for mental health counseling and family counseling. Strong Minds, which is also a nonprofit organization for mental health counseling, and many more. So I've also been working with the outreach coordinator and the public health nurse to identify resources for different aspects, such as hoarders, elderly at risk for falls or failing health condition, and homeless individuals such as shelters and additional programming such as counseling services. So my biggest accomplishment, I will say 153 new cases is a lot for one person, which included 22 co-response calls. I feel like I've successfully built relationships within the departments and organizations and mental health agencies, especially with the police department and even fire, just learning about the different laws and policies within the departments in general, and the services that can be provided. With Mental Health Association, they have been very helpful in providing that support in terms of like the structure of the program, and providing referrals to a strong relationship with Michelle, who's the senior social worker for Maplewood and South Orange, and referring the elderly to groups, whether it's social or support groups, and linking them to counseling or case management. The school districts, starting to build a collaboration with them to better help students and their family members. The hospitals have been trying to build a relationship with them. It's been very difficult, because when they don't respond back to email, it's kind of like you have to know someone in there to be able to get connected to the right person. But however, Overlook and St. Barnabas, they have been very receptive to us when we communicate, or if we call to inquire about, a patient who was taken over there, they've been very receptive with providing us with, not much information, but just, listening to the feedback or recommendation that we have for the client's care. Translating for the Haitian community, whether it's explaining services that are available to them in their native language and also translating certain documents. I know we had, a document about lead that we were able to translate in Haitian Creole and kind of give it to the family so that they're more aware and educated on what lead poisoning is. Just so that they can better understand. And also individuals have been referred to and linked to counseling services, hotlines, utility assistance programs, rental assistance, and many more. All with the help of the health department and local outreach coordinator in that sense.
I feel like we should give you like a round of applause.
And then there's all the things that I've participated in, partnerships and relationships. This is the community fridge, helping them stock up. Also, we kind of had a table with the health department, and we had Zufall Health and ADAPT come out to provide resources, and we were giving out free COVID test kits to individuals. And this is me, they had a senior event at the Maplewood Senior Center. Michelle, Amy Stewart, I was able to meet them, introduce myself, and start building a collaboration with them. So the plan, as I said, the cases, it was a lot. So I really do need the help, in terms of getting someone else, a part-timer, because I do anticipate for the number of cases to grow as people become more aware of our services. And most people have a good understanding of the program and what's in contact. Definitely help is needed, whether it's hiring a part-timer or a full-timer. With a part-timer, we will see, and I anticipate to see an increase in co-response calls, because most of the calls that I've missed is because I'm not at work. So I'll have to set some boundaries. I can't pick up every phone call. So usually on Tuesdays, since I'm not here, or even, for example, today, around like 5 o'clock, there was a call that came in, but I wasn't responding because I'm not on the clock. So if there was someone else there, we would see an increase in those full response calls. So as I mentioned before, during the working hours, all the calls that come in, I do respond to them the same day. However, with the follow-ups, and some of the calls I received via phone, it has been taking me a little more time to respond, whether it's like usually like 36 to 48 hours, probably less, depending on what I have planned for the day. And that is because, there's a lot that has to be done, so I can't get to everyone in such a short amount of time. So it's been taking me a little longer. So I have been prioritizing the call response calls and the walk-in services, and then I get to all of the other phone calls and email referrals later on. So with the different needs that are within the towns, more individuals need immediate assistance. So this assistance can only be possible if we do have a part-timer available or someone else here with me. The plan also is to reduce the chronic callers, find better resources for the homeless population, and find more mental health resources for referrals and further case management counseling, and just being present at the community fridge with the local health outreach coordinator to be able to identify certain individuals who may be in need. And also me personally, my own goal for this year is to attend more trainings, just to kind of be more well-rounded and also network more with individuals. Last week I went to Essex County College. They had a Homeless Connect Day, and they had all the homeless organizations in Essex County present. I was able to meet different people, provide my business card. They gave me their pamphlets and what services they provide. It was just a great way just to connect with individuals. I've also attended the adult mental health aid training. I'm scheduled to attend the youth mental health aid training on the 13th. So I'm putting myself out there and just, getting all the information that I need just to be able to come back here and give it to our residents. So, that's all I have.
Thank you so much.
Thank you.
Any questions?
We'll open it up first, I guess, to you guys online, because I think the folks in the room
Yeah.
asked a bunch of questions.
Maybe the online folks, you guys start, and then I've got a few questions.
I have a question. Katrina.
Yeah, sure.
Oh, okay. I have a couple of questions, but one is thinking also about your point about resources. Do you ever say no? I'm reminded that when people call 911, there's always a response. Are there times when you say that's out of my jurisdiction or not within my terms of reference? And do you make, or in your official reports, do you make recommendations around addressing the chronic issues or the homelessness and the other kinds of issues that you identified? I'm not saying you have to, I'm just asking, is that part of what you do as far as your job goes? Thanks.
Okay, so for the first question, there has been individuals who call me who are not Maplewood residents. I've had received calls from work residents, from West Orange residents, who just call just to inquire about certain resources, whether it be housing or what they should do if, they're looking for mental health counseling. These resources are available to everyone, so I have been providing them with that resources, but also, if I'm unsure of something, I'll do the research myself and get back to them. I just feel like everyone who calls should be getting some sort of help if help is available. If I'm able to provide that help. So if it's linking someone to a mental health counselor or providing them with a website to an application for housing, affordable housing, whatever it is, I have been providing that. The second question, I did not get the full thing. Does anyone remember what the second part of the question was?
It's, do you make recommendations in your reports as to how to address some of the bigger picture issues and how to reduce some of the recurring issues?
Thank you.
Yeah, of course.
So I make recommendations. I follow a format where I kind of give like a brief description of what's taking place, the assessment, how they're presenting in the plan. As in what type of resources I provided the individual with. And I also do a follow-up just to make sure that individual follows up with that resource. Ultimately, it depends on the individual if they want to accept this plan or not. Everything is voluntary. So if I'm making the recommendation for setting up a plan for this person to reach out to, let's say, Mental Health Association for ICMS service, which is case management. They can choose to accept that or not. But I do, in that sense, yes, I do make a recommendation. There is a plan in place so that this does not reoccur, but sometimes, it's successful and sometimes it's not successful. But that all depends on the individual, like I said, because sometimes they can choose to accept it or not.
But it sounds like you're definitely making recommendations on how to maybe stop the cycle.
Right.
The cycle in place for an individual.
Mhm.
You're not necessarily making recommendations like, how do we solve homelessness in Maplewood?
Yeah,
Not yet.
not yet.
Any other questions?
Thank you.
The folks online? Okay,
All good.
I have a few questions, but do you guys, anybody else?
Yeah, I have a question. Have there been any examples of times when you were called on a co-response and it wasn't immediately clear what your role should be? Or do you feel like things are very aligned, that you get pulled in when it's appropriate and that, you have a role in those situations?
I do feel like, they've been calling me for appropriate cases. There hasn't been a time where I'm just like, well, I'm not here.
Right.
I think the dispatchers and the officers clearly know what I'm here for.
Mhm.
And they make the appropriate referral. Even if I'm not here, they have my business cards and they provide the family with my contact information, the office number and my email to follow up.
Mhm.
And they also provide me with the, you know, the incident number or the person's name, phone number, so that I can follow up with them. So there is a clear understanding, as well with, the fire department as well.
Mhm.
There's a clear understanding as to when I interview.
Mhm. That's fabulous.
Mhm.
I think that's so, it's amazing to see that so smooth.
Yeah, in the
that you
beginning, it
get
was a
plugged
little
in.
rocky.
Yeah,
You know, because I don't think no one's heard of this program before. This is something that's starting up. So as time went on and I started figuring out, you know, certain things, like when I really should be called, you know, I'm relaying that message to them as well and just reminding them, hey, you know, you can call me for this, don't call me for that, but you can definitely call me for this, and they've been doing a pretty good job with that.
that's fantastic.
Yeah, yeah. So actually following up on that question, this is a question for DC as well. I can imagine, especially at the beginning, that we also may have missed some, you know, that the officers might have responded and just forgotten to call Martha, or maybe not have been always totally clear on like what was the right situation. Like, how do you feel like your SOPs are being followed through, or is there any analysis being done to be like, oh, we missed, you know, so-and-so, like this came in and we forgot to call her, or we should have called her, we didn't realize there's that kind of situation. that kind of
Well, we
thing.
have a secondary review process.
Yeah,
So after the officer initially responds and they get the incident in the case, when the case is sent to the detective bureau,
yeah,
if there's no case note that she was contacted, the detective will then advise to contact her.
okay, all right,
So like two separate entities is looking at it.
okay. That's good. So do you feel, I mean, I'm assuming the answer is yes, but since we're here in public, I mean, do you feel like it's running pretty smoothly from your point of view?
I think it's going very smoothly, but I definitely think we need more hours. We definitely need more hours.
Okay, well, that was gonna be, that leads into one of my other questions, which is, I know that there's a proposal in the budget to bring in, I don't know if it's a part-time person or a full-time person. I'd be curious if there are any specifics about the scope, and I'll look at you, Bailey, because I know you help with that, but also you, Martha. On, like, did you have proposals about like, yeah, I want somebody to start covering the hours I'm not on, or I want somebody along on some of the same hours as me because I've got too much happening during the day, or like what kind of proposals or what kind of suggestions did you make in terms of?
I mean, with something like that, it's still in the works because we have to figure out what's the best time to put this person on. Whether it's after hours or, you know, if there's an overlap, maybe there might be a day or two where we overlap
Yeah.
so that we can kind of like transfer, you know. I do a morning shift and this person does an evening shift type of thing, so it's really difficult to tell because we just don't know when calls are gonna come in.
Yeah,
They come in at just like I used to be on Sundays. But then I got off on Sunday, I left the Sundays because there wasn't that many calls coming in. But then as soon as I left Sundays,
Yeah.
Monday, that's when all the calls started coming in on Sundays. So it's like, it's difficult, so it's something that myself and Candace, we have been discussing,
yeah.
just to kind of see what's the best time to put this person on.
Did you ask for somebody part-time or full-time?
Part-time for now,
Okay,
and then, you know,
So part-time for us is up to 29 hours a week,
oh, okay,
so it's not like 2 or 3, it's,
Yeah.
it's so. And that really just dictates whether you provide benefits or not.
okay,
So, I think there's support on the township committee to bring one more person on.
okay.
So I think we
I was
have,
gonna ask if you just had a budget discussion.
yeah, but we've been talking about it for a while.
Okay,
And the way it's working is that we're allocating money from the apothecary and dispenser. To cover one of the people. And because they provide a community benefits fee.
Right.
yeah,
So that'll cover one person and town funds will cover the other person.
okay,
Oh, so it's two part-time people.
But it will be,
Oh,
that's the idea.
okay.
Can I ask maybe a related question about coverage and hours? So if there are calls that are coming in and you have an MPD response and you're not on duty, and let's say they give your card, are people really calling you afterwards? Like people?
they are
Sure,
actually,
okay.
yeah, they are, I'm coming. Like I'm coming to, you know, some voicemail, so they are calling.
Okay, great,
Some don't call, but
yeah,
for the most part, they definitely are calling.
okay, great.
But that's
That's
fine.
fine. Thank you.
Yeah, once people know that there's someone they can go to, they will call you all the time. I can attest to that because I work in social services for the state. People literally call me over the weekend, Sunday night, early in the morning. It don't matter. When they need to talk to someone, they're gonna call.
That is true, and you know, it's up to me to just kind of set boundaries, because, you know. Sometimes I feel bad for them and I just respond right away with like resources, but then I have to remember, this is my day off, self-care. I have to remove myself from work.
Me too. Yeah.
So,
Say.
That's important. That's so important.
Okay, so my next question is, it's amazing that you're able to work with the Haitian community, given your background, you're able to, you know, speak Haitian Creole. Have you identified, are there other, like, I mean, I know that was part of like the appeal, obviously, of hiring you, but, you know, you kind of lucked into you are a social worker, that you have to speak Haitian Creole. Are there other things like that you've identified, like we have a growing Latino community in
Right.
Maplewood and things like that, like are there other skills like that you think?
yeah, for sure, definitely there is a large immigrant population here in Maplewood, whether it's Creole, Spanish, so I have encountered a few of them. The good thing is that for the most part, they do speak English, but there has been some barriers, in terms of connecting them. Or them being able to identify what services that they can actually apply for, so this is where I come in. Helping them filling out applications, if I have the time, someone needed help with like SNAP benefits or Medicaid, just helping them sit down and really go through that whole process with them, I've been able to do. So it's not just Haitian Creole, but it's more than, I have identified other areas as well.
Okay, so my last question is, this is something that I was thinking about after, you know, some of the town halls and things that we've had recently about crime and that sort of thing, seeing that you're providing services to people who have been victims of robberies and sort of helping with that trauma response. I don't even know if it's a question, but I was like really happy to see that you're doing that. I wonder if there's an opportunity to kind of build that. I mean, maybe that's all been new, but it's something that I've been thinking as one of the things is we think about how to tackle this issue. Like that's something that we can. I don't want to like add more to your plate, but I do feel like having some kind of response to those situations for the people who have been victimized is a really great idea.
Yeah, and it's something that, to be honest, I didn't think about that. It was one of the detectives who actually said, they weren't this person would actually benefit from some resources can you provide, because, you know, something traumatic happens.
Yeah.
And they keep ruminating on it and it's causing them not to be able to sleep or
Right.
PTSD. Is there anything that you can offer this individual? And it was my first time, I'm like, oh, I never really thought about, you know, robberies or home invasions or anything like that. Even when I consulted with Mental Health Association, because they have a program similar in West Orange, they were actually surprised and said that, you know what, that is actually a good idea. To even add that as to like, you know, like a full response or even just following up. Just
I
providing
wonder if there's something that like, because obviously you interact with the victims usually, right? So I wonder if there is some kind of protocol that we can write to say like like you're taking a statement, you're doing all these things, like to then offer up like, you should, you know.
Yeah,
you
so
should
all
follow
the
up.
detectives that do interact with victims and have to interview people for especially serious nature crimes are advised to provide them with Martha's.
Oh, they are.
information.
Oh, okay,
Yes.
so that's already happened. Okay.
Yeah, it's been happening for a few months now.
It's her call volume.
Yeah.
Well, I want to do that on-
Yeah.
So you mentioned 153 calls. Of those, how many repeats? I mean, what's the average duration that you stay with somebody and do you call back again, 2 times, 3 times?
So, yeah, this does not include the follow-ups.
Right.
Follow-ups is almost double because I do, not just, one and done. Sometimes it is one and done. But then there's other times where they require, not constant, but like, a few times, it's just a call, check in, or they'll text me, this is how I'm doing, or even if they need that emotional support afterwards, they have been reaching out to me for that, so. Sometimes it's ongoing, but for the most part, I try to let go, after I let them. Yeah, like if I'm linking them to another agency, I let go, but then sometimes they need help navigating with that agency as well, so. Sometimes I don't let go, so it's hard to let go.
Has there been any discussion of like having a social work intern? Is that like, that sounds to me like a role for someone who's maybe in that position where they can help someone finish off that navigation with that, right? And that wouldn't have, they probably couldn't manage what you do in the part-time sense as that role, but I don't know, I'm just curious.
Possibly in the future, it's not something that we thought about yet,
Mhm.
but, it's something that can be discussed once we kind of have like, a better understanding of, this whole program, the structure, and then if we do get a part-timer, just kind of getting them established first, like once we have a rhythm of things first, then we can look into that. Yeah.
And I guess in that vein, whether there was any role for volunteers as well, right? Like someone who's not necessarily trained as a social worker, whether there might be some assistance someone could do if they wanted to, a town volunteer or.
With
maybe-
that might be tricky because of HIPAA.
Yes.
It's confidential information.
Sure.
So with the volunteers,
Mhm.
I don't think that would be the best,
Mhm.
way to go.
Mhm.
But if it's a social work intern, someone who has an idea with the social worker code of ethics,
Mhm.
HIPAA, confidentiality, and how to respect that,
Mhm.
yeah,
That makes sense.
yeah,
I get you as much help as possible.
right.
Speaking of that, my question was gonna be that, how can we support you? You're here now. I know we talked about, the additional, hours or additional part-time folks, but, I know, and I was gonna speak on this, in the section about, role of police in schools. I know the department is starting a youth bureau, right?
Yes, the
Yeah.
community engagement unit.
So that focusing on, I think, on youth, when we took the tour, they said there was a section strictly for the youth.
Correct.
Yeah,
It's
so
separated out now.
separated out. So is that someplace that, we can maybe, either you or when we develop the hours and we have someone supporting you can engage that so that, because I think the goal of that youth bureau is to really just keep kids out of the system, the process. That's what the detective told us when we did the tour. So maybe, having someone else there in a social work kind of capacity can actually help foster that, because I think what you guys are doing is great, because I think you're talking more about restorative justice within the department, not what we were doing before, where you were referring that out. So I feel like having a social work as part of that group, besides just the detectives, could be positive. So that's something, MPD could do, something you agree with, or when we have that part-time person in place. Maybe that's something we can, maybe facilitate, kind of having that, having you or someone else in that.
Right, or someone specializing with adolescents.
Yes,
Yeah,
yeah.
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 I do work closely with Detective Jamodi, whenever he has any cases, once he handles everything, if there's any additional follow-up that needs to be done with the user or the family, then he refers them to me, so, I think, I think it's a good idea, but of course,
Yeah, yes, time, yeah.
It sounds like you're already doing that.
Well, yeah, I think it's like just add more time to it and have it a little bit more dedicated, because I feel like, some of the youth, it's traumatic for them, like to be in a police station. Or to be, talking to detectives or, even after whatever is taking place, I think so I feel like, having someone who's trained, who's maybe can sort of you know, the situation has been diffused and that's, you know, de-escalated, whatever, but also to be there to support the child, and, you know, and we'll find out more, all right, about the youth bureau, what their scope is and everything, and so we can talk about that later. Yes.
Yeah.